Hi, my name is Charles Sanky, and I'm from the Icahn School of Medicine at Mount Sinai in New York. It's my pleasure to be with you today and to talk a little bit about the social determinants of health that impact our emergency department patients, looking specifically at the experiences of discrimination that they bring to the ED. Our research was graciously supported by NIH funding, but I'd also like to disclose that although I am a person of color, I am a white passing male talking about discrimination that I don't experience at the same level as the communities that we serve. And so today I'm here to speak not for them, but to share a little bit of what our patients might experience. So the ED is disproportionately used by vulnerable populations, including marginalized racial and ethnic communities that seek this sometimes as their primary care. Patients identifying with these groups come to the ED also with significant health disparities, including difficulty accessing healthcare services, as well as other structural barriers. Now, these contextual factors are known as social determinants of health. And although we've had a longstanding understanding of social determinants of health in our public health efforts, getting those integrated into healthcare and specifically into the ED has been a challenge. Also, lifelong experiences of discrimination are believed to impact patients as well. As they come seeking care from our EDs, sometimes they may have doubts. Sometimes this may affect their health outcomes as a whole. But this, again, has not been assessed in the ED setting. And so what we sought to do was to try to understand, one, to what extent do our ED patients bring these experiences of discrimination with them? To what extent do they have these? And understanding what other social determinants of health do they face? We all face social determinants of health, but what risk factors do these patients have? And so to do this, our pilot study was conducted with adult patients at Mount Sinai Hospital's emergency department, again in New York. Patients were randomly selected from July to March of this past year. And patients were excluded if they were younger than 18 years old, or if they were in our resuscitation area and unable to participate, or if their mental status prohibited them from doing so. And so anytime we create an instrument, we want to use validated measures, and we use a compilation of validated measures in previous social determinant of health assessments to create a survey that was administered verbally by our research team over the course of 5 or 6 minutes, and includes all of these type of factors here, including built environment, education, all the things that you can imagine as a typical social determinants of health. But we also added experiences of discrimination. And with that question, we sought to understand descriptively how many face discrimination on the basis of race, ethnicity, or color. Again, self-identifying. And also looking at the associations. For these populations, what social determinant risk factors were unique to those participants? And so in this pilot study of 277 participants, we had patients ranging from 22 to 90 years old, male and female. We have a very diverse population at Mount Sinai in New York, including in this sample, we had a high percentage of people who identified as Black and African American, which is a little bit higher than our normal demographics of our ED, but the rest of this is pretty representative. And so this is a really important slide. We didn't just ask about discrimination as a whole, but we asked about particular settings. And you'll see that at the highest, we have almost a third of patients saying that they have experienced discrimination on the street or in a public setting. And we have a tenth of patients saying that they have experienced discrimination in getting medical care. Almost 60% of participants reported at least one of these categories. And you'll see that although most of them fall into these categories of Black, African American, Hispanic, or Latino, a lot of them fit into these other categories as well. Just to highlight a few examples, for discrimination from the police or in courts, this was almost a quarter of participants. And as one might expect, this was also associated with other factors like identifying as male, stress, immigration status, and again, identifying as Black, African American, Hispanic, or Latino. Interestingly, also associated with difficulty accessing medical care. Also like to show this one, discrimination when getting medical care on the basis of race, ethnicity, or color. A tenth of participants, interestingly, identifying as Asian was highly associated. Difficulty accessing medical care, of course, that makes a lot of sense for us. And then participants who face loneliness or isolated, as well as who faced immigration challenges, or who were immigrants rather, identified as having had experiences of discrimination in getting medical care. And so what does this mean? What this kind of shows is that this is a very complex thing, that a lot of our patients come to the ED with experiences of discrimination, and there are a lot of factors spanning identity, psychosocial factors, and socioeconomic factors that are interwoven and interlinked, and there are these bidirectional and complex relationships between all of these. And they're also reinforcing where experiences of discrimination then may go back and impact a lot of these social determinants of health. And so for us, although this study had some limitations, we did focus in this pilot study on only 277 participants discriminated against these categories, and looking only at lifelong experiences and not necessarily at the particular impact of those discrimination experiences. What this does highlight is that many of our ED patients experience discrimination and have these risk factors related to their social determinants of health. And so maybe paying attention to these social determinants of health, as well as these experiences of discrimination, may yield some insights for us as we try to improve the health outcomes of our patients and the populations that we serve. Additionally, as emergency department physicians and healthcare professionals, it's our responsibility to think about how our places that are designed for healing are not places where patients may be hurt more, and paying particular attention to experiences of discrimination and how our encounters with them are therapeutic and building trust rather than an experience of discrimination will be important. I'd like to thank my research team, as well as the patients, of course, at the Icahn School of Medicine at Mount Sinai. This would not have been possible without them. Thank you so much.